Welcome, everyone. As folks are joining and filing in, we're going to get started in just a minute. We're really excited to have you all here for this webinar today on the purposeful consumer. And we're going to be learning all about intention related to cannabis consumption. And that's very exciting because for a long time, it was assumed that cannabis consumers were a monolith, that they were all interested in the same thing out of their experience, that it didn't really matter what product they chose as long as it had THC in it. And there were even questions about the role of who you're consuming with and where you're consuming and whether that even impacted your experience. And so we are really excited to share these data today because I think it's going to give a whole new insight into why people are consuming, how they're consuming, and how brands and retailers can give the education and products to their consumers so that they can achieve their goals. So that when they consume, they're getting out of it what they want to get out of it, and they're not getting negative effects from their consumption. We're going to talk about all of that today. So I think we're going to go ahead and jump in because I know we've got a lot to cover. So I'll just introduce myself and then I'll have our two panelists introduce themselves and we will dive right into the data. So I'm Dr. Amanda Ryman. I am the Chief Knowledge Officer at New Frontier Data, and I've been studying cannabis consumers for 20 years. And the little anecdote that I will give is that I collected data on 130 medical cannabis patients back in 2005. And at that time, it was the largest sample of medical cannabis patients in existence. So to think from 2005 to 2022, when we are now looking at patient data for tens of thousands of patients, it really shows you how far we've come in really such a small amount of time, as the legalization, of course, has been moving across the country, but also as we understand the importance of knowing more about who consumers are and what they're involved with. So, New Frontier Data, we're all about the data. As our name says, we're here to give insights and information to those working in the industry so that they can better serve their consumers. And we do that in a whole host of ways. You can check out our website, New Frontier Data, to learn more about what we do. But today I'm joined by two amazing folks from the industry who are going to give us some insights into this. So David from Jointly, why don't you go ahead and start us off with your intro?
Sure. I'm David Kooi, K-O-O-I. I'm a co-founder and CEO of Jointly. Jointly is kind of the source of the data for this report. My background, just real quick, the best way I have to summarize it is that I like solving problems using data. And I've done that across a variety of industries in my career, starting with, diesel engines, commercial trucks, buses, software that helps manufacturers manage the inventory and their distribution systems and their dealer networks, industrial supplies, bicycles, and now I'm enjoying doing it with cannabis. And so I've been studying cannabis first for my own personal benefit since about 2012. So I'm newer to the subject, and then specifically with Jointly since about 2018. And so I know enough about cannabis to know how much more there is to know that we don't know yet. And that's why I've always been a fan of New Frontier Data, because it's companies, in my opinion, like New Frontier Data that kind of bring light to the industry by making information available and public and useful and clear. And so, because Jointly is the source for this data, I thought I'd explain real quickly where it comes from. So Jointly is a technology data platform that gets expressed right now through our website and through our mobile apps available for iOS and Android. And on those apps, we help consumers find the best products for their goals, and we help consumers create the conditions for a good experience. And so, as consumers are using our app, they're choosing or selecting one of these 11 or 12 goals that you see in this report, and then they reflect on their consumption, and it reveals insights that helps them get better results. So they track things like dose, time between doses, sleep, hydration, quality of their diet, exercise, etc. And they learn how those factors impact their cannabis experience and how their cannabis experience impacts their own well-being. And so they, as they do that, we've built this data set over the years of people using cannabis to make their lives better in productive ways. And so, so that's where it comes from. That's what Jointly does. I think the data set's really super interesting. Obviously, I've been immersed in it for the last few years, so I'll try not to be a bore about it. I'm mostly excited. I wish I could just be an audience member and listen to what Sarah and Amanda think about this. But I think there's a lot of really neat things in the data. I think in the data is the proof that the stigma is false, because we literally have people using cannabis for productive purposes and finding success. So it becomes clear that the proof is in there that the cannabis is a complex plant that can be used for many different purposes, that people use it for productive purposes, that it affects everyone differently, and that you can create the conditions that improve your results. And so to me, when you add all those things together, it's a proof that the stigma is false, and a proof that we have a really interesting, future for this industry as more and more people get to know those truths and get to understand those, both brands and retailers, but especially consumers. Yeah, it's about it for my introduction. I would say too, that we call this report a report about the purposeful consumer, but it's my opinion, and I think I have the data to prove it, that nearly every cannabis consumer is a purposeful consumer. All you have to do is peel back one layer and it shows that, even for the person who's shopping just for the most THC per dollar, if you peel back that layer, very few people are just where the high is not the end result that they're looking for. It's to relax, it's to sleep better, it's to be more creative, it's to focus. And so when you peel back just a single layer, in our data, it's very obvious because people choose the goals that we provide. But any survey New Frontier has ever done, any poll you read, when you talk to consumers, I'm sure Sarah has 1,000 examples from her experience. Everybody has an intention that or kind of a goal that they're after. They might have a different word for it, but and I think that's pretty exciting, because it means that the future of this industry is not only about converting legacy consumers to new consumers, legal consumers, but can be expanded to all these people that grew up with the stigma and are confused by the stigma. And yeah, I think in here somewhere is proof that cannabis is the greatest opportunity to help people feel better from perhaps of this century.
Well, thank you for that great introduction and for the work that Jointly is doing. Because, I'm sure that Sarah can also attest to the difficulty that especially newer consumers have in navigating the product choices and really trying to hone in on which product and which environment is going to give them the best experiences. And for a long time, before we really even had testing, we didn't really even know what the potency was of different products or the terpenes or any of that. It was really just hit or miss for a lot of folks, which is why journaling became so important, so that people could really talk about their experiences with specific products and find what works for them. Because as we'll see from the data, it's variable, and what works for one person isn't going to work for another person. The impact of one product is going to be different than another product. So Sarah, I would love for you to introduce yourself. And I know that you have had your finger on the pulse of the consumer experience for a long time in this industry. And so we're so happy that you're here to join us.
Oh, thank you, Amanda. I'm so pleased to be here. And I mean, what can I say? Like, spending an afternoon with the two of you geeking out on data and consumer patterns is like my favorite thing to do. Hi, everybody. My name is Sarah Payan. I'm an educator, writer, a policy advocate, and I'm the host of the Planted with Sarah Payan podcast. For over 10 years, I was first the director of education for the Apothecarium dispensaries, and then the public education officer. So I look at how we're training staff in dispensaries to be able to engage and create enriching relationships with our consumers, not just to sell them product, but to actually listen to what they're talking about and to help them create a container for safe exploration so they can figure out what dosage works for them. Because as my colleagues are talking about, we are walking chemistry experiments, and what works well for one person may not work well for another. But as I always say, conversation is normalization. So if somebody has that chocolate covered blueberry that helps them sleep and they talk to a friend about it, it may not be the same product, it may not be the same dosage, but it's piqued the interest and it's created an action. My work, I do outward facing education for the public. We are missing a large section of the public. We preach to the converted quite often, and there is a whole bunch of other people who could really use cannabis, but because of the impact on bad policy and, quite frankly, some very greedy racist policies in the past, the stigma's made it hard for people to find cannabis accessible. In addition to that, I have a consulting practice where I do consults with people putting together their products. I work with dispensaries throughout the nation in how to properly train and engage their staff so that they can have these enriching conversations, create relationships, and not only are people satisfied with their choices, but they come back. In addition to that, I work with product development and I teach at higher learning institutions and healthcare organizations, as well as doing individual consults with physicians and their patients. And if you like podcasts, check out my Planted with Sarah Payan podcast. I also write for Cannabis Now and am a Rolling Stone contributor too. Thank you for having me today.
Well, thank you so much. And I mean, talking about having your finger on the pulse. I mean, because we're looking at these data, it's a robust data set across like 80,000 consumers. And then the question is always, well, how does this translate to people's everyday experiences on the ground? And how does this translate to practical advice that brands and retailers can take away about how to better serve their consumer base? And so that's exactly what we're going to get into today. All right. So let's talk about intentions. So these are the goals that Jointly has set out for their consumers. And I think I'm going to do that. There we go. So that everyone can see it better. All right. So here are the different goals that people have. As you can see, the most common goal is relaxation. And this really mirrors what we see in our New Frontier data as well from our consumers. Relaxation is overarchingly the biggest reason why somebody's using cannabis. Now, of course, relaxation means something different to everybody. So, within this context, it could be relaxing after work. It could be relaxing after a grocery trip. It can be relaxing after a work trip. So there's a lot of contexts here. Unsurprisingly, we see stress relief as number 2 and improved sleep as number 3. These 3 reasons I have found come out consistently across data sets. So David, Sarah, I don't know if either of you have any comments on why these 3 intentions seem to be just so much at the forefront of why people are consuming.
I would say because sleep and stress and relaxation are all huge parts of homeostasis in the body. During the pandemic, I started taking my classes online because we were doing them in person for many years. And the sleep, anxiety, and depression class was getting about 250 people attending for the first year and a half. And because when we're stressed, we can't sleep. When we can't sleep, we get stressed. It's a cycle. It affects our health. And I think especially in this crazy world that we're living in, where we're running from moment to moment and getting inundated with all sorts of stimuli, we need something to help us create the balance.
Excellent point about their interrelated, how they're all interrelated. And yes, when you are stressed, it's hard to sleep and vice versa. So that makes total sense. David, do you have any thoughts on these particular outcomes that we're seeing?
Yeah, it's not, I agree with what Sarah said. It's not surprising in a world that is constantly winding us up, whether it be when you watch the news or at work or family, or just it's the rest of the technology that we use that's designed to push our buttons, that people who are out there looking to improve their well-being using cannabis would find relaxation and stress release as the kind of a common primary goal. One of the things that's interesting about the data set that we didn't include also is that these goals are remarkably similar across geographies. So the people of New York are just as stressed out as the people in Texas, and the people in California are just as stressed out as the people in Ohio. So one of the things that unifies us is that everybody needs a little stress.
Well, I love that point. And then when we think about the long-term impacts of stress on health. So, stress, mild stress for, a couple weeks while you're working on a big project may not be that big of a deal. But if you have serious stress issues, for a consistent amount of time, you're looking at other health problems that are going to be related to that. And so, unsurprisingly, one of the first studies I did, we asked people if they were using cannabis for medical purposes and if that was for a physical condition or mental health condition. And 75% of people said both. And what that tells me is that they are connected. And when you have chronic pain, for example, you may have anxiety, you may have depression, and that these things are very interrelated. So one of the great things about cannabis that we hear from people is that they are able to use it to address multiple types of issues, which prevents them from having to use pharmaceutical drugs for each one of those issues. And speaking of the use of pharmaceutical drugs and of alcohol and other substances, I do want to call attention to the replace other substances here on this chart. Even though we see it as the least common goal at 1.3%, it is a very specific goal that people have. And we're going to talk a little bit more when we get into the product use. We saw some really interesting product choices and product efficacy around replacing other substances versus some of these other reasons, which I think really speaks to how intentionality can really benefit folks when they're looking to change their behavior. So just really quickly, if you have questions while we're going through this, feel free to put them in the Q&A. If they are questions that have to do with what we're talking about, then I will go ahead and answer them while we're on the slide. And if they're more general questions, either Heather will get back to you with answers or we will answer them at the end. All right, so let's talk a little bit about non-cannabis factors, because one of the things that's so interesting to me about the jointly data is that not only are you looking at things like which product people are using, what time of day, who they're with, what their dose is, you're also asking people to record non-cannabis factors, such as their current diet, their exercise level, how many hours of sleep they're getting, hydration, when the last time they ate. And so, looking at this, what you can see is that for some goals, like relaxation and easing pain, the cannabis factors, so the actual product itself, how much you were taking, really added more to the outcome. For some of these others, like enhancing intimacy, the non-cannabis factors were more important when adding to outcome. And what really fascinates me about this is that it poses the situation that cannabis is just one of many lifestyle choices and behaviors that contribute to relaxation, easing pain, improving sleep. Because even when we look at relaxation, 64% is accounted for by cannabis factors, but 36% is accounted for by non-cannabis factors. So looking at things like your sleep and your diet and your exercise can be a way to meet these goals more effectively than just the type of cannabis product you're choosing. David, I would love to hear your thoughts on this balance and also why jointly decided to include the ability to record non-cannabis factors.
Yeah, this is one of my favorite subjects in jointly and in this report. We've tried to find a number of ways to express it over time. We've tried pies, like we're like, if your pie is, if at 100%, that means you're having the best possible experience with your cannabis product and dose. But it's a situation that presents to me an interesting problem for the industry, because you could be growing the most beautiful flower, perfectly clean, wonderful manufacturing facilities, like deliver it to market fresh, and somebody could go home and have a bad experience with it because they didn't know about the other half of the experience that was about creating the conditions to have a good experience. And so we included it. Well, I guess at the very beginning, we included these sort of factors because I realized in my own journey with cannabis how much the non-cannabis factors were impacting my experience with cannabis. And I realized how little data there was about that when I searched for it myself to try to figure out, why is my experience so variable? Some people might enjoy a variable experience. I like a more predictable experience. And so I wanted to be able to control that and get the kind of experience I was after more often. And so it presents an interesting problem for product makers and marketers and messengers to not only make great products but help their consumers have a good experience with them. We've invented various terms for it over the years that we've been working on it. One of my favorites that we've never used publicly is called pie high, which would mean your pie is full at 100%. But if you're dehydrated, for example, that's going to on average take about 15 to 20% off of your pie. Or if you didn't sleep well the night before, that might take another 5 or 6% off your pie. Or if you get your dose wrong, that could take a whole quarter out of your pie. Who doesn't want a whole pie? So kind of.
Well, no, I love that explanation. And, Sarah, I would love to hear from you, not only when you talk to consumers, but when you're talking to retailers and brands, especially brands. To David's point, are they thinking about these non-cannabis factors? Are they thinking about ways to kind of guide their consumers to having, considering some of these non-cannabis factors as a way to really meet the full level of enjoyment that they can from their product?
I don't think that brands think about it as much as they should. And, it's been interesting because this is why I love data. This is why I love seeing what people are doing, because you know what works for you. You don't necessarily know what works for somebody else. And I think that a lot of times, like brands, when they're developing products or they're reflecting on their products, I don't know that they're getting as large of a population group and finding the feedback so that they can really see what's going on. It's kind of like how, and I say this with, I don't mean it to be critical, because there are several brands that are wonderful that I love their products and I love what they do, but the whole naming a product after a quality can be really misleading, because one person's calm can be another person's hell. And, after, 18,000 hours of experience with human beings in cannabis, I've seen some really interesting anomalies, especially like when we're looking at females or people who were born assigned female at birth with uteruses, and we're talking about like estrogen. So we are more sensitive to THC right before we ovulate and less sensitive right before we menstruate. And these are things that people don't understand. Also, the fact that like we talk about CBD, and as we all know, that was like the word forever. And I used to joke, it can save your marriage, wash your car, do all these amazing things. Honest, right? And physicians are quite often, that's the first thing they'll recommend, because they worry about euphoria and getting somebody in a bad state, and maybe the setting is not appropriate. But we also know now that even though it's a small portion of the public, it's larger than we thought before. People are sensitive to CBD. It can create a general malaise. It can actually do the opposite of distressing. It can actually get people quite agitated. And then we also have the cytochrome P450 interaction with pharmaceuticals as well. And these are things that I think we need to have more conversations about, because whether we're looking at it from the old days in the medical market or in the new adult use market, it's a substance that creates a reaction in the body. So we need to be working to create greater engagement with the public and really setting them up for success, and using tools like what both of you are working with, and really like enriching our industry and consumers with, to like capture this information, get more and more information, because I feel like as we continue and more consumers are using it, we are going to get more interesting reactions, which isn't a bad thing. That's the thing. We can talk about the fact that we all create our own endogenous cannabinoids, but not everybody tolerates phytocannabinoids. And I say that in my classes, and then I always say, and that's okay. Because as human beings, we often think, well, if it's not good for me, it must be bad, and I'm going to actively work against this. Well, that's not true.
Yeah, no, absolutely. And I think that's a great point about brands kind of looking to talk about the effect that a product is going to have. And I understand why. When we do our New Frontier consumer survey, the number one thing consumers want to know is, how is this going to make me feel? And when we start talking about products in a few minutes, we'll see that, there is an effect of having a standardized product where you know exactly the milligrams of THC, exactly the milligrams of CBD, and that it's going to be the same every time. So one question that we had coming in from the audience from Dell Potter, hi Dell, is about, how many of these people that are using cannabis as a substitute for other things are doing it for pharmaceuticals, and how many of them are maybe doing it for another reason. And while we don't have that differentiation in these data, it is something that we have in our consumer data, so I can definitely follow up with you. But when we start talking about the individual product choices for the different intentions, I think we'll have a clearer picture of how people are using different products as substitutes and how that might be different if you're substituting for alcohol versus a pharmaceutical drug. So we're going to get into that in just a minute.
And Amanda, I'd add to that a lot of times people don't realize that they're lessening their use of pharmaceuticals and alcohol until after the fact. All of a sudden there's a moment of reflection and they're like, wait, I haven't had a glass of wine, or I haven't been using my benzos at all because I've been feeling really balanced.
Yeah. Oh, absolutely. And, again, having a tool like Jointly allows people to track that progress and to figure out which product was it that you were using when you didn't feel the need to drink, or you didn't feel the need to use your pharmaceutical, so that you can access that again. And so we're going to be transitioning now to our discussion of set. Now, I just want to do a little disclaimer because, set and setting are used in a lot of different contexts. So I just want to give us the context for today. So when we talk about set today, we're going to be talking about the mindset that is created by the cannabis product you are using. So what is the impact of that specific product on you as a person? And then we'll get more into setting when we talk about where you're using it and who you're using it with. But we're going to start off talking about products. So this first chart here, we are looking at what people are choosing product-wise in order to meet certain goals. So this is not what they are deeming most effective at meeting these goals. This is what they are choosing in order to meet their goals. So as you can see, flower, not surprising. It is the most commonly used product in most cannabis markets, so it would make sense that it was the most commonly chosen product to meet these different goals, but it's not uniform. So whereas 71% of people are choosing flower to stimulate their appetite, only 56% are choosing flower to replace other substances. And similarly, when we look at edibles, we see that 12% of people who are choosing edibles are doing it to replace other substances, when only 2% are using to stimulate appetite. So we definitely see some differences in terms of what people think will work best for addressing some of these different intentions. So a couple things I want to point out, and then I would love to get your thoughts on this chart. So I mentioned edibles. The other thing that was really interesting to me were drinks. So, drinks, a very uncommon choice, which we know it's a very small part of the market at this point. But when we look at replacing other substances, we see a much higher rate of beverage as being the form of choice. Now, of course, my theory on that, and going back to your question, Del, is that these are people that are replacing alcohol. And so if you're going to replace alcohol with cannabis, a beverage is probably the most likely choice, not only because it's replicating the form factor of the alcohol, but if you're using it to replace alcohol in a social situation, then, smoking or other methods of ingestion may not be available to you. And with technology like nanoemulsion, we're starting to see faster onset times for beverages, which means they're going to be more akin to drinking a beer or a mixed drink in terms of how fast it hits you. One of the big issues with beverages for a long time was that they hit like edibles. So like you're hanging with your friends and they're 3 beers in before you even start to feel the effect of your choice, which is really difficult to have parity. So I think seeing a higher drink choice among people that want to replace with other substances makes a lot of sense. Another area where we're going to talk about that's very interesting is dabs. So even though we see dabs as a pretty uniform choice across categories, in a few minutes, we're going to see that's not necessarily true when we're looking at what's most effective for meeting these goals. I'll also point out that when we look at recovering from exercise, we see higher rates of tincture use and especially of topical use. So topicals really don't appear until we look at recovering from exercise. And then we're like, all right, that's where the topical use is happening. Makes total sense. Many times we're looking at localized relief, so stiff joints and muscles, and folks may not want to be intoxicated after their exercise, depending on when they do it, and maybe choosing topicals for that reason. So David, I would love to hear your thoughts on product choice related to intention.
Yeah, you covered a lot of the good points there. I think
Sorry, I didn't mean to take all the good ones.
that's all right. That's all right. No, to me, this one gets interesting when it's combined, when you look at the intersection of this one and how effective things are. So, for example, and I think there's a big, perhaps like information or education gap or a data gap for consumers where ease pain, for example, that 1.3% of people who are choosing a topical, like if you're smoking to ease pain, you should also try just try some topicals on whatever hurts, if it's a thing you can put a topical on, obviously, because there's like this kind of untapped potential all across the right side of this chart. Is the way I feel when I look at this, and it's a tricky one for consumers because it on the one hand, it's like the best time ever to be a cannabis consumer because there are so many choices. But when you walk into a dispensary, it's hard to have these other choices brought to your attention effectively or efficiently or in a useful manner. So, what else can I say about these?
Oops.
Oh, you were getting, I love the way you guys did the graphics on the next one, by the way.
We'll get there. I keep hitting the button accidentally. Sarah, do you have any comments about the types of products that people are choosing? And before you answer that, we did have a question come in about a previous slide, and with their intentions, could they choose more than one? No, they were asked about their most common intention, correct, David?
When people are using the app, they can choose up to 3 goals for each session. So we do allow, because we know that people have kind of, like we were talking about on that other slide, kind of they might combine stress relief and sleep, or they might combine pain and relaxation or something like that. And so, one other thing I wanted to mention about replace other substances, it is kind of a known issue with that goal for us that it includes both replacing drinking and replacing other drugs. And so that's why you see some numbers in there that look like they're for both, because I think people use that goal for both use cases.
Absolutely. And we did have another comment come in about drinks and the onboarding of a low dose, consistent amount for people that are looking to substitute. And I think that makes a lot of sense. We'll talk a little bit more about what that looks like when we get into the form factors and the effect. And then we also had a question come in about age differences, which we will be getting to here in just a little bit. Sarah, I'd love to hear your thoughts on the product choices that people are making for these different intentions.
Yeah, I think that, the reason we see a lot of, excuse me, high flower use is because, one, people are familiar with it. They know what the effects will be. The onset is quick, which a lot of people want something that has a very quick onset, which is also why I'm really excited about the nano emulsions with drinks. It's not just the fact that we don't have to drink sludge on the top of a cup anymore. But I think that we have to have a greater conversation about efficient use of products. And I think that if we had more conversations about that, I think that this chart would look a lot different because people don't like to take financial risks on products that they're not familiar with. So if we're not having the conversations about it and people don't have an opportunity to even try it out without making the financial decision to take it, a lot of people will choose not to, especially in these markets where cannabis is extremely expensive, and yet we're seeing very large extinction events, which is always interesting. But when we're looking at edibles, for example, when we see ease pain, we see 59% of people are using flower, 8% are using edibles. Well, if we had the conversation around it, we would say, to ease pain, that means that you're going to be smoking probably every 2 hours. Is that an efficient use of product? we could be using something like an edible, which I liken to the window of effect as the same as a pharmaceutical, which would be much more efficient. It would, cover a larger amount of time, so you're spending less money. But then we have the lovely journalism from Ms. Maureen Dowd on edibles a few years ago, which was the worst investigative journalism ever. And it got people afraid of edibles. When we just have to create, how do you go about experimenting with it? Well, start really low. And even if you have a high tolerance for smoking, that doesn't necessarily mean that you're going to have a high tolerance for edibles, because these are metabolized different through our body. So I think that there needs to be more, conversations about the efficient use and expectations. And I think that would really change this chart. And with drinks, I really think we should keep an eye on them because, like you said, people are using it in lieu of alcoholic beverages. We're seeing a lot of non-alcoholic beverages on the market too that people are getting really excited about. But especially with these low dose beverages, if somebody is a social drinker, they can use something, they can have a few drinks throughout the evening or the afternoon and not worry about over consuming. For people who may have a higher tolerance, they may choose to use a higher dosage beverage, especially if it's like at night and they're wanting to just kind of kick back and have that 20 milligram drink. But it really is like thinking about like, what's my dosage? How am I going to use this? Do I want something that's kind of one and done for the rest of the day, or maybe just having a couple times during the day? Am I in a social situation where with social lubrication, you feel like you want to have several beverages, so you want to be aware of how much you're using? So is it a lower dosage that you're going with? But I think that, what we're seeing here with the product use by goal is really just a pattern of people going with what they're the most familiar with. And this is where educating, staff and the public to have these conversations, staff to be a productive matchmaker with consumers, and consumers so that they're empowered. So no matter what dispensary they go to, they can look and figure out what works well for them. And also, quite honestly, could save some money with appropriate choices, which may not necessarily be flower.
Well, I think you make a great point about folks not wanting to take that risk. And so for a lot of people who were consuming flower prior to legalization, they feel like they know flower. And yeah, maybe it gets them 80% there to their goal. But for them, that's a better bet than trying something like a tincture that maybe they've never tried before. And now maybe they've wasted $30 to $60 and they don't get the outcome that they want, or they get a negative outcome. So I do think that people stick with what they know. And, that's why we still see flower as, kind of the most common. But something that's interesting, and we are going to talk more about age and other breakdowns, is when we look at the New Frontier Consumer Survey, we definitely see a move towards manufactured products more among young people. So people that are kind of coming of age in legalization and aren't just starting with flower and the unregulated market, and then are saying, well, I want to have X effect every single time, and realizing that manufactured products may be more successful at getting them there.
Yeah, one of our discarded slogans, another one, is about this subject, is to get off your local maximum. So a local maximum is like somebody enjoying flower who's like happy with how things are going. They've done it for a long time, but they don't know about this array of other new alternatives now where there could be something better, but they're stuck down here because it's what they're used to, it's what they're comfortable with. It has less risk because it's the sure thing. But there might be 3 or 4 better pathways for them that are available now. So.
Oh, absolutely. No, great point. Yeah, like I said, folks are very comfortable with flower. They know how it's going to hit them. They know how much they can use. And then some of these others, there's a learning curve associated with it. And as Sarah pointed out, not all dispensaries are equipped or willing to take the time to really help people understand all of these different product verticals. And instead are just like, well, what do you usually use? And let's just keep going with that unless it's bringing a negative result. But speaking about results, this is a really fascinating chart for me. I love charts. I especially love this chart because here we're looking at product type with average success rating. So looking at what people are saying works best at helping them achieve their goals across these different product categories. And I promise, David, I won't pull out all the interesting things this time. I'm going to hand it over to you in just a second.
Oh, go ahead.
But the one thing I am going to point out, only because we've been talking about replacing other substances, is that when we look at this chart, drinks and dabs well, drink is tied with flower, but we see drinks and dabs way up there. And especially when we look at dabs, the highest rated goal is replacing other substances. So I just want to point this out, because getting back to Dell's point about the difference between replacing something or using cannabis to replace alcohol versus using cannabis to replace prescription drugs, I think that this chart speaks to that quite a bit. And we see people are using drinks to replace other substances and finding that very successful for them. But when it comes to dabs, we're seeing that replacing other substances is really the highest rated use of dabs. And so when we think about people that are trying to replace opiates or other very intensive pain medications, or trying to use cannabis instead of opiate post-surgery, that getting that really strong infusion of THC or cannabinoids very quickly may be what they need to really do a true substitution for some of these more intense painkillers, or people that are trying to use because they have dependence. So if you have dependence on alcohol or you have dependence on opiates and you're trying to find something that's going to quell those cravings or address those withdrawal symptoms, people may find concentrated cannabis to be most successful. I will point out that don't use dabs if you're trying to enhance intimacy. It's something that we're learning, learning from this chart. That may not be the best choice for you. If you're trying to enhance intimacy, it looks like flower or vaping might be a better bet for you.
And apparently, perhaps kissing after the tincture is also not somehow used.
Right, not somehow working. But, again, to speak to that alcohol substitution, when we look at the highest ratings for drinks beyond replacing other substances, we see stimulate appetite, but at the highest we see enjoy socializing. So that really gets to the use as a replacement for alcohol in a social context that is helping people still participate in social activity without drinking. So David, I'd love to hear your thoughts on some of these.
Yeah, I love this one. And one of the things that was fun with working with New Frontier on this is the way you guys did this visually. We hadn't thought to do that before. And it's just, I love the way the bubbles kind of call your attention to the interesting parts of the chart. And so to me, I mean, drinks just pop out as the biggest news on this chart to me. Because, I saw something on LinkedIn the other day that some executive said in an interview that drinks were going to be a $20 billion industry. I don't forget what the stat was in 10 years or something like that. But this suggests that there's a lot of potential in drinks, that people are having a better experience on average with that method of ingestion than with the others. And it's just, it's such a small part of the industry now, and it's such a small part of our sample set. It's big enough to be statistically significant, but still very small, like we saw in the other graph. But just, it looks to me like drinks and edibles have a lot of potential to help people achieve these goals. That to me is pretty exciting, and especially given how few choices there are in the average dispensary for, like, if you're shopping for a drink, there, at least in a lot of my shopping experiences, there's not a lot of breadth or depth in that category. But this suggests that people, there's a lot of potential there for people to reach their goals with beverages.
Yeah, absolutely. And I'm seeing beverages pop up more and more. I'll give a little shout out to Plant Shop, which is a local dispensary in my community that has a whole fridge of drinks and so many different options. And I've really found it wonderful. I really don't drink alcohol. I do enjoy cannabis beverages, and there's a lot of different ones on the market. So, if that's something you have the opportunity to explore, I think that that's definitely worth it. Sarah, I would love to hear your feedback around medical consumers. So, when we look at things like ease pain, we see edibles, as you mentioned, right, being the most rated successfully for all the reasons probably that you brought up. We also see things like improving sleep, drinks and tinctures are being most effective. So kind of these more medical type products versus flower. So I'd love to hear any thoughts you have about, like, medical use of some of these form factors.
Yeah, absolutely. I think that, when we're looking at edibles, like you said, because of the larger window of field, people are often choosing that to get relief. Also, with sleep, when people will ask me, I need a product for sleep, the first question I'll ask them is, are you having problems getting to sleep or staying asleep? Because if you're having problems getting to sleep, having something that's fast acting that may not stay in your body as long may be better for you so you don't have a groggy morning. But if you're having problems staying asleep, you probably want something that's going to stay in your body a lot longer. When we're looking at things like tinctures, a lot of people are looking for products that don't have a high amount of sugar in it, or even like when we are looking at edibles that are tablets, it's like there's no carbs, there's no sugar, there's no fat. There we have many more consumers that are actually really concerned with what's in the product that's not cannabis related and how that's going to affect their body. Dabbing has been something that we've seen for years where people are using it in lieu of other pharmaceuticals, but also to get them off of other drugs that they may have complicated relationships with. But when we're looking at it around pain management, it's kind of a double-edged sword because it can be very effective, but it also calls to greater education around terpenes and cannabinoids and how those affect us, because it is so concentrated that it can be very effective. But on the other hand, if they make the choice of the wrong, cultivar or chemovar, it could actually create dysphoria, which means that even though it's not in reality amplifying the pain, the perception of the pain can be amplified. So we really want to be cognizant of that. But I can't tell you like how interesting it is to see like just the different things, and also just how people metabolize things, because sometimes people don't metabolize edibles, and researchers are thinking it has something to do with our livers and how they're metabolized through that. But when we look at stimulating appetite or helping with nausea, we probably want something that has a quick onset. So we would be looking at an inhalable, or if somebody can't or does not want to inhale, we'd be looking at a sublingual like a tincture, because that would be faster acting. So tinctures, smoking, edibles, these are all really popular. And as we start to see drinks go up, I haven't seen as much drinks for medical use. It's been more social, but I'm excited to see those numbers because I do believe people should take as much advantage of the different modalities of use as possible.
Oh, thank you for that. All really, really great points. And, we had a comment come in from the audience that, maybe one of the reasons that people are still really stuck on flower, besides it being kind of what they're most used to, is that they feel like they're getting more information because they know the strain. And so they have this kind of like attachment still to this kind of, nomenclature around what strain it is. And I think, to that end, we're seeing companies like Kiva do single origin edibles. So, if you are really a fan of a certain cultivar, you're now able to find that essence of that cultivar in another form. And I've seen a little bit of that happen with drinks as well. So I think it is possible that we'll start to see more differentiation in the manufactured marketplace, not just by a standardized dose, but by where the origin of the product comes. Because I know that there are folks that are concerned about isolates and distillates and what that means for the effect in a manufactured product. So I think that that's something that will be really interesting to see moving forward. So before we get into setting, David, we had a couple questions come in just about the data that I thought we could take a minute and answer. Do we have any sense of how experienced the folks are who are with cannabis, who are answering this survey? And do we have a sense of around how many experiences each person is entering?
Yeah, we don't ask people their level of experience when they sign up or when they complete their profile and all that. So I don't have data on that. From anecdotally, from conversations we have with users, it's a mix of people that have been smoking for 30 years and people who are using jointly to just get into cannabis for the first time. But I don't have any data, unfortunately, on that. And then what was the second one?
How many sessions someone, like an average somebody enters?
Oh, right. That also varies a lot. And the easier we make the app to use, the more sessions we get, obviously. But so I think at the time of this report, it was 80,000 people that had recorded 208,000 sessions or something. So on average, it's just under 3 per person that have been recorded. But that isn't super indicative because a lot of, how people use apps. Some people come in and record one session and they're like, this isn't for me. And then they've never used the app again. And then some people record 30 sessions. And so the average is about just under 3. But then there's a distribution where there's a whole bunch of people who have just recorded one experience. And then it kind of, there's a curve after that 3 that people seem to start getting the most benefit from our app once they've recorded about 10 experiences. So we also have data that says, and I should probably mention this in my introduction, people who use our app and have recorded at least 10 sessions enjoy their cannabis experience about 40 to 50% more than when they started, just by learning how to, not even really necessarily by using our insights or the data and analytics, but just by becoming aware of the fact that these 15 things can impact their cannabis experience. And so if you're a retailer or brand out there and you want people to enjoy your products 40 to 50% more, we have a free app.
Awareness is such an important piece of this. So just a couple more comments to some answers to some audience questions before we jump into setting. So we did not have on here what people are replacing when they're using dabs. So we'd say that they're replacing another substance, but not specifically what they're replacing. We do have some data on that in our consumer survey. So if that's something that interests you, you can contact me after and we might be able to get that up for you. And then regarding edibles, these are just broad edibles. So this isn't necessarily high THC edibles or balanced THC CBD edibles. It's just edibles as a product type.
Yeah, it's edibles in general. We do have the data on what those edibles contain and have it. I forget if we included anything in this presentation, but we can break down the edibles by dose and by cannabinoid content to see how the goal success varies by dose and cannabinoid content. And there's some interest. I think there's some interesting things in the report that folks can download about that as well.
Excellent. All right. So let's move on to talk about setting. So again, we are talking about set in terms of the effect that the product has on you. So we looked at which products people are choosing for which intentions and how successful those different products are at helping them reach their goals. And now we're going to move into talking about setting. So when we talk about setting, we're looking at where people are consuming, and we're also looking at who they are consuming with. And I think there's some very interesting policy implications, Sarah, for some of the setting data. So first, let's start off with time of day by goal and location by goal. And I don't think there's anything too surprising here. I think what it's showing is that these data are reliable and valid because they're tracking what we would expect based on somebody's goal. So somebody that is looking to improve sleep, we would expect that they are consuming before bed. And yes, we're seeing almost half of those folks consuming before bed and about 71% consuming in the evening or before bed. Whereas if somebody is looking for energy and uplift, we're seeing more daytime use prior to the evening. And then when we look at location by goal, there's one thing I want to point out, which is one of my favorite things I've ever found in cannabis data. And then David and Sarah, I want to hear your reactions to these charts. But as you can see, most people are consuming inside the home. So first of all, we need social consumption opportunities because people need to get out of their house and have opportunities to consume cannabis places beyond their home. But something that I really wanted to call out is that nature is included in this. And you'll see on this chart that it's not a very common place for people to consume. We see energize and uplift as a goal. Maybe we're seeing a little bit more nature use, enjoying socializing. We're seeing a little bit more nature use, but really across the board, we're seeing inside the home as being the most common place that people are consuming. So I want you to remember that for in a minute or two when we talk about the setting that's most likely to help someone achieve their goal. So David, do you have any comments? I know, like I said, this is pretty self-explanatory and I think it makes a lot of sense, but is there anything that jumped out to you around time of day and location related to what people's consumption goals are?
Yeah, I agree. It's a lot of just a kind of a reflection of the obvious that you don't energize and uplift much before bed. But I agree. I think as we'll see in the later graph, the tragedy is how much of it is taking place at home. Because I feel like there's a whole lot of potential outside the home that isn't being utilized. both obviously because of laws and also I think when you talk to people, some of it's about just comfort level. Like if you're going to be using cannabis, a lot of people are more comfortable doing it in the privacy of their own home. But if there were safe opportunities to consume outside the home, I think that's both market expanding and would help people with higher success ratings.
Yeah, absolutely. And it also helps with normalization, right? When somebody's just has to use like in their living room with the shades drawn and like the towel under the door, like we used to do in the olden days. It's hard to make cannabis seem like a normal thing that people can do responsibly as adults. It definitely encourages this idea that it's something that needs to be hidden, that it's something people can't do and then be out in the world safely and responsibly, and that it's something that they should be ashamed of. And for a long time, people felt shame around using cannabis because they had to use it in such a clandestine manner. So Sarah, I would let you've been working in this field for a while, and I would love to hear your thoughts on kind of the evolution of people being more bold about where they're consuming and how this relates to them achieving their outcomes.
Well, I think a lot of it also has to do with the culture of where you're living, right? Because when we see cannabis policy, we don't see it based on a lot of fact. We see it based on state culture and stigma. Unless you're lucky enough to be in California, and then there's just a whole other bunch of stuff that's in there too. But I was really surprised to see the numbers on the outdoor and the nature, because, when I was experimenting, when I was much younger, that was like the place to go. Or, concerts and cannabis went hand in hand. But it does call for better policy around being able to consume outside of the home. And when we are looking in the home, it's a call also to change what we're seeing on the federal level, because we have a lot of people, if we look at the medical side of it, there are a lot of people who are disabled on fixed incomes living in Section 8, and they could easily lose their homes if they're caught using cannabis in their homes. So there's that too. But yes, I agree. We need to get out and be social with our cannabis use. And, I guess I almost wonder too, when people are reporting out too, because there is a stigma about being outside of the house and use. I wonder if there's more usage than we know. I mean, it's kind of like when we used to look at like the senior population, people would say seniors were the largest growing population of consumers. And I would say, no, actually, like if you spent an afternoon in my dispensary, you would see a lot of gray hairs. But they also grew up in a time where using cannabis was a very private thing and they weren't talking about their business. So I think we get more people who are self-identifying. So these are things that I wonder too, like I'll be really interested to see what these numbers look like when we are more in an age of normalization and people will say, yeah, I did bring my vape to that concert, or when I go for hikes, I bring a joint with me. I wonder how free people, even though like the three of us live in this very different world where it's very normalized and it's all around us and we can freely talk about our usage, I wonder how free people actually feel to have these conversations still.
And that's such a great point because, I think about especially people with school-age children and people who are trying to present as a certain way in their community. And so, if you're at the park smoking a joint and like, here's your like kid's friend's mom, coming through the park, how are you feeling about that? Are you feeling like it's okay? Are you feeling like she thinks worse of you because she sees you consume cannabis? So there is so much still attached to that persona as a consumer that will impact how willing people are to be open about it.
Yeah. And I'd also say when we're looking at the times of day, because there are a lot of markets that aren't as fortunate as the California market to have these emerging cannabinoids available, and a lot of them are more on the non-euphoric side, as we start to see more of those available in markets throughout the nation, how many people will use those for daytime use? Because I know for myself personally, I love using CBG during the day. It's non-euphoric. It helps me stay productive. Just my body in particular. But, as more people start to realize, hey, I can use these cannabinoids, be productive, not get high, it actually will add to my productivity, what we'll see like in a year or two.
Interesting. Oh, so fascinating. Yeah.
I'm also a huge fan of CBG and would love to know more about it. I wish there was more information and research on it because I think it's a cannabinoid with a lot of potential. One thing I noticed the other day looking at this that I thought was interesting, but perhaps somewhat controversial, is the location by goal, energize and uplift at school. And so we have a lot of our users, just by nature of it being an app that people use to track their cannabis consumption, are younger, in their low 20s. So I picture them at school using cannabis to keep themselves awake and focused on the subject that they're learning. And I think it actually could be a good thing, but there are so many things to get past for that to be acceptable that, it's going to be a long time.
Oh yeah, that's a sticky wicket there.
Yeah.
For sure. So I want to move into ratings by where people are consuming, because this is one of the things that was so interesting to me as someone who also loves to consume in nature, is that even though nature is, one of the least common places that people are consuming, it has some of the highest ratings in terms of helping people meet their goals. So when we look especially at energizing and uplift and enjoy socializing, it really starts to dwarf to some extent some of these other places, right? Where, especially inside the home, which is most common where people are using, is not necessarily giving people their best outcome. And so, back to your point, Sarah, as we start to see normalization happen, as people have more choices, real choices about where they want to consume, helping people understand the connection between nature and meeting their consumption goals is a whole area of education we haven't even gotten into yet. Before I get to you, David, I'm curious if you have any thoughts about the role of these different locations in helping people meet their goals.
Yeah, I love this one too, because this is the graph that gets me. I also love consuming in nature. And I think there's kind of like a setting-based entourage effect with nature, where like, if you go out in nature without cannabis, it's going to be uplifting, it's going to be relaxing, it's going to be enjoyable if you're going for a hike with your friends or your family. And so when you combine the mood elevating aspects of being in nature with the mood elevating impact that cannabis can have, I think that it makes perfect sense that somebody's perceived the quality of their experience as they perceive it is higher, because it's the benefits of nature working together with the benefits of cannabis to give you what you're after,
Yeah, and I think, to that point, when we look at this and we're looking at both nature and outside at home, we see in a lot of categories, outside at home is more effective than inside at home.
Right.
So, even just going into your backyard or out on your balcony or, on a porch and consuming when you have the fresh air and the sun, seems to have an effect, even if you don't leave your property. Sarah, I'd love to hear your thoughts on that.
Yeah, it kind of goes with what I always say, cannabis on its own is great, but combined with other, modalities is like, it creates that full picture. It's like I'm a water baby. I was, raised on the Great Lakes. So every time I'm near a large body of water, it's like I sleep like a baby at night, because you get that, just like the air and the water and everything. And then you add cannabis to that, and you're already a little bit relaxed, because you are like actively taking yourself out of your everyday life to a place that promotes relaxation. It kind of reminds me of like, if you go up to Calistoga and you get a hot mud bath, you're that much more relaxed for the massage. So it's much more effective. You know what I mean?
Well, it's interesting that you say that, because one of the things we find from looking at cannabis tourism is that the interest is really in this effect pairing. So people don't want to go to Colorado and go to a dispensary and then go sit in their hotel. They want to go to a dispensary and then go hiking, or go to a dispensary and then go to a concert. And so, it really makes sense that when people are, they're using cannabis to enhance these other experiences that are already great and that are already contributing to quality of life. So I think it's great. Instead of it just being about cannabis and kind of putting all of your eggs in the THC basket, it's really a combination of set and setting, I think, is what these data are telling us.
Well, and Amanda, I'd add to that, like, whenever, because, well, it's starting to pick up again, but prior to the pandemic, we had a lot of consumer purchasing on the tourist side. We had a lot of cannabis tourists coming through San Francisco. And the biggest thing that they would ask was, well, where can I consume this? Because I don't want to just sit in my hotel room and that's not, I'm not here, I'm not visiting beautiful San Francisco to sit in my hotel room high.
Right, right, exactly. I think there's so much opportunity there. All right, so let's look at where people are consuming or who people are consuming with in terms of meeting their consumption goals. So I think a lot of this is dependent on what your goal is. So, as we can see, things like recovering from exercise may not be as important to consume with another person. Whereas, when you're trying to enjoy socializing, it makes a lot of sense to consume with another person. So I think that intention definitely plays into who you think is going to be the best companion. Of course, kids, strangers, very small percentage on this. We're really looking mostly at people consuming alone, which again, gets back to the need for social consumption. And then consuming with their significant other for things like enhancing intimacy. There's no surprise that that's something people are looking to do with a significant other. And then, friends and family really to a lesser extent beyond just enjoying socializing. David, do you have any thoughts on, kind of the role of your companion in reaching your consumption goals?
Yeah, what we're after with this is a kind of a difficult question to interpret for me, because what we're after with this is to teach people that they can have a better experience if they're with people who they enjoy and that who accept what they're doing, and they're not necessarily hiding their consumption. So we've been talking about if there's another layer that we can add to this question that's about whether the people you're with are like people that you like or people that you know and they are aware of your consumption, are accepting your consumption, or if you're hiding it, or and so that it's a question where it's difficult to interpret the results, but I know that it's a factor that when you drill down to the individual user level, can make a big difference for people. If you're consuming and you're with people that are aware of your consumption and accept it and are also consuming, then everybody's kind of feels more comfortable, mood is elevated, you're going to rate your products higher, etc. But like if you're with your family and they don't know that you're using cannabis, then that might have a negative impact. And so
Oh, absolutely. And, I speak to, and Sarah, I'm sure you've experienced this with some of the earlier dispensaries, especially in the San Francisco Bay Area. Social consumption was just a huge part of their model. And a lot of that, as you mentioned, David, came from the fact that it was still very highly stigmatized. People didn't necessarily feel comfortable consuming in their homes around their family. And so they were looking for other people that were very accepting of consumption where they didn't have to worry about being stigmatized. And early dispensaries really played that role. And, I'll go back in history just a little bit more to say that a big part of that model, even coming to light in the first place, was because of the stigma around being an HIV/AIDS patient in San Francisco in the 80s and 90s. And a lot of the early dispensaries had lounges, not just to give people non-stigmatized environments to use cannabis, but to offer people non-stigmatized environments to be HIV and AIDS patients, and without the social isolation that was happening because of the misunderstanding and ignorance around how the disease was spread. So Sarah, being someone that's worked in San Francisco in dispensaries, do you see a yearning or a desire from people to still have that ability to consume with others that are on the same page with them about cannabis?
Oh, absolutely. Absolutely. And we can't forget that those dispensaries with consumption were community centers in themselves. I remember talking to Michelle and Michael Aldridge about during 9/11, and they got a call from staff saying, hey, we've got people lining up. They're terrified, they're sad. We're going to open up, we're going to order a bunch of pizzas, and people are going to sit together and spend time together because this is a very scary day. So people were they were community centers, and those were the models that we were looking at. Even dispensaries that didn't consume had some sort of community element. Like at Apothecarium, we had the little church kitty corner to us where we had all these different support groups to be able to support different members of the community, and the relationships that grew out of that still even continue today were amazing. It's just a really, really rich thing. And then when we're looking at like consuming with family, when I used to work behind the bar, just a little bit before Thanksgiving, we'd start having people come in who normally bought flour that were all about the edibles because they had to deal with their family. And the first person who said that they was purchasing something to deal with their family, I'd always give them something free. I'm like, you're my first one of the year of many that are going to be coming in.
Well, that's when we saw the advent of Green Wednesday, right? So, kind of our own Beyond 420 purchasing holiday, people with the Wednesday before Thanksgiving who are traveling, they're going to see relatives. And, in my world, it wasn't just about me consuming, it was about them being curious about consumption and trying to find products that were appropriate for my 72-year-old mom and for my cousin and other people that maybe lived in illicit markets. So I think that there is this kind of bonding that happens when people use cannabis together, and it's just a matter of feeling comfortable, right?
Mhm.
That people support what you're doing.
Absolutely.
Yeah.
And I just add one more thing. Like my mother-in-law was not into cannabis, but she was dealing with a lot of foot pain and had a walker. So I brought her some infused Epsom salts home. So I'm her favorite daughter-in-law now.
Well, let's get into some demographic differences because we've had some questions come in about gender and about age. And, are these methods for reaching goals similar among different demographics? Are the goals similar among different demographics? And we also had a comment coming in about adverse effects of cannabis, and we definitely looked at side effects, and dosing. So we'll be talking about that as well. So first, let's look at goals of use by age and average success rating by age. So the goals of use by age really didn't surprise me. And I'd like to hear from both of you if it surprised you at all. I think, looking at kind of general relaxation being a goal for somebody that's younger, who maybe doesn't have the aches and pains of aging, doesn't have the hormonal issues that can lead to sleep disruption, and are really just looking for like a relaxation tool. When we get to improving sleep, we start to see age go the other direction, with older folks being more likely to have that as a goal. And then, of course, easing pain is another place where we see older folks more likely to choose a goal, whereas socializing is something we see among younger people. None of this surprises me. When we look at average success rating by age, we see that for some, it definitely helps certain ages more than others. So for example, replacing other substances, we're seeing very high ratings among millennials, which I think is really interesting. This is usually the time of life when you're put on your first long-term prescription medication, when you start to first think about your alcohol consumption and are you drinking too much and what are the health effects of that? I mean, when you're under 26, you don't really think about those things too much. So it makes sense to me that this age group is really starting to investigate, like, do I want to drink this way for the rest of my life? Do I want to start on this medication for the rest of my life? And maybe cannabis is another option. So I thought that was really interesting. Otherwise, we see pretty similar across age. We see with stimulating appetite, a little bit of an effect for younger folks, same with enjoying socializing. But David, I'll throw it to you first. Does anything surprise you on these charts?
Surprised me. I guess one of the things that's interesting is that people under 26 across most goals seem to have slightly better success ratings. And I don't have a good hypothesis as to why that is. I don't know if they're more educated about cannabis and so they're better at using it. I don't know if it's because our endocannabinoid systems age and we don't know much about that yet. I don't know. But in terms of the part on the left, goals used by age, that seems to make sense. It is kind of interesting that that the stress relief numbers don't vary much by age. Like it's 22% for under 26. It's only 23% for 58 to 76. And so,
Well, I think stress is universal.
appears to
Right?
be universal across age these days.
Yeah. Well, I mean, it might be different stressors,
Right.
right? The stressor of an under 26-year-old might be different, but I think it's a universal issue that people have, that they've been using cannabis for so long. Sarah, what are your thoughts about this?
Well, when I'm looking at this, I think about like the different ages and like I'm still at the age where I get curious about technology and get into things, but you know, you start to, like, as you get older, I think you lose patience and you're like, I'm a Luddite. And it's like, no, you're not. You're just not as inquisitive as you were when you were younger. And I think that the reason we see higher success rates with some of the younger demographics is because there is that inquisitiveness and there's that willingness to do more experimentation. Because I can't tell you how many times I used to have people come in and say, hey, Sarah, I'm trying to use cannabis for this or this or this. And I said, well, what happened? And they just look at me really frustrated. And they're like, I don't know. All I know is that it didn't work. And so that's why creating that container for experimentation is so important. And apps like Jointly are really important to be able to give people the framework to be able to be conscious of their consumption and to capture that information so that they don't forget and get frustrated and just look at it as it was all a failure. I don't know what I'm doing.
Ron, to that
I like
point,
that.
if you are asking your friend and they're in a different age group than you, and I'm, 25 and I'm asking my 65-year-old friend what works for them and what product's best for them, that may not be the best comparison for all the reasons you mentioned. And, even within the same age group. So it really points to that individual kind of dose and product that Jointly can help you discover what works best for you. David, you had a comment?
Oh, I just really like that phrase she used. Was it container for experimentation? I like that. We say that experimentation is the key to purposeful consumption, because it's like one of our, I don't know why I keep sharing discarded slogans, but one of the other things we say is that Jointly lets you perform an N=1 study on yourself. And you can experiment with goals, you can experiment across product types, you can experiment across doses and find what's working for you, but it's the experimentation that gets you there. And so I think that's probably true, that as you get older, you become on average less open to experimentation. Perhaps that's a good potential explanation for that. I like that.
Or maybe just like having less patience for like, oh, well, this isn't working. Let's just throw it on to the next thing. But the one thing that I always tell people is, even if your experimentation didn't work the way you wanted it to, you've just captured really important information on how you personally metabolize cannabis. You haven't wasted your time. And it's an important thing for people to note so they don't get frustrated and stop their experimentation.
Right.
That's an excellent point. It's good to know what doesn't work for you as well as what does. All right, let's look at frequency of use or frequency of side effects. So this was something that's really interesting. One of the things that Jointly asks, cannabis is great for a lot of people, but it does have side effects. There are negative outcomes that can happen from cannabis use. And, as Sarah was just saying, a lot of it is figuring out what doesn't work for you so that you know more about what does work for you. So we did take a look at age and looking at side effects and then dose, because it is possible that these two things are related. So we do see side effects more often among younger people. So younger people are reporting more dry mouth. They're reporting that they're more munchies. They're reporting more red eye. They're reporting more drowsiness. And also on average, they're using slightly higher doses. So when we look at folks that are consuming 30 to 50 milligrams at a clip or 50 to 100 milligrams at a clip, we definitely see an association there with age for a lot of that. So it's very possible that that is a connection. It's also possible that people that are newer consumers, meaning that they're younger consumers, haven't figured out how to manage their consumption to alleviate side effects yet. They're still in that container of experimentation. And so they're more willing to try different products, whereas older folks might say, look, I know that consuming these joints does really well for me. It may not get me 100% where I want to be, but it gets me mostly there, and it doesn't have any negative side effects. So it's really the best choice for me. Do you have any thoughts there, David, about side effects and dosage?
Yeah, one other thing I'd add there that's just kind of a caveat about the data too is I also wonder, when I look at this, if people under the age of 26 are more likely. I get the impression that people under the age of 26 are more open these days about their mental health, about their wellness in general. So they might be more willing to be in touch with the fact that the side effects are present, whereas people my age might want to tough it out, and so there could be some of that in the data as well.
Interesting.
I can't believe how many people have dry mouth. It's just
That's very, very
the
common side
what,
effect of cannabis.
small advertisement for the app as people and it's not one of the easiest parts of the app to use. We're working on it, but you can track your incidence of these side effects, and you can learn how the same 15 factors that impact your goal success rating impact the probability that you'll have these side effects. And so those same things like hydration and diet and sleep and setting have an impact on the incidence of these side effects as well. And so you can learn to mitigate them through tracking those same factors that impact the quality of your experience.
Very interesting. And that again is part of that. I'm going to go back to Sarah's phrase, container of experimentation, where people are learning about the relationship between some of the products that they're using and what they want to happen and what they don't want to happen. Sarah,
the interesting sort of, sorry, one more thing real quick. The interesting sort of to triangulate these two with the previous slides is people under the age of 26 are taking higher doses and reporting more side effects, but also reporting more success. And so I haven't been able to reconcile that entirely, other than to say maybe they're taking the right dose. I don't know.
Or taking a wider variety of doses,
yeah,
which is helping them land on the correct one. Sarah, I'm curious what you think about the side effects, and is that something that has been a big deterrent to people in your experience with patients and consumers over the years to consuming cannabis, or do they just kind of look at it as like an occupational hazard?
It seems like when people are first dipping their toe into cannabis or returning, that's one of their biggest concerns. People who are new to it, you know, they've heard all these horror stories, especially if they're older and have been influenced by stigma of the past. I even had somebody come in who said that they had a bad experience on LSD and wanted to make sure that that was, and I promised them that it was not going to be the same experience. But, you know, the numbers surprised me because I agree with David. I think that people under 26 are much more open about what's going on with their bodies and being able to report back, because in our society now we're more open about talking about what's going on with us, especially as, you know, for younger people, which I think is a beautiful thing. But I was surprised by the numbers, you know, for the 58 through 76, because you know, a lot of research is suggesting that as we get older, we actually become more sensitive to cannabinoids. So I would have expected there to be more reports back of frequency of side effects.
Well, that could be related to dose. So, you know, we're seeing folks in the 58 to 76 range using primarily 5 to 10 milligrams per dose. Very few are using anything above 20 to 30. So that sensitivity, you know, could be dose adjusted. But it is really interesting that, you know, that as we get older, we should be more sensitive. But maybe some of the, you know, one of the things we're also finding is that people that are longtime consumers have fewer side effects. So maybe there's an adaptation that happens in the body over time to where the side effects aren't as salient when people get older.
Yeah, I can definitely see where that would be. And we also see a lot of, even though our older population still enjoy THC, people who are either returning or new to cannabis and in that age range, a lot of times are looking more at low to no euphoria solutions too.
Right. And, you know, there's a comment that came up in the chat here about, you know, relationships between, like you were saying, David, things like people being dehydrated and dry mouth. So if you're somebody that isn't hydrating, are you more susceptible to dry mouth or red eyes as a result of your cannabis consumption? So again, really thinking about these different factors and how they are related to outcome. So I do want to get to gender because we don't have that much time left and we still have a little bit more to cover. So, you know, this top chart is really just showing that when it comes to goals, which goals people have, there isn't a ton of difference from gender. So, you know, that relax and refresh is that biggest bar there, you know, followed by stress relief, followed by sleep. And it's not that different, right? So in terms of what goals people are choosing, we're not seeing many gender differences. Where we are seeing some gender differences is in success rating. So when we're asking people, you know, how successful was this product or experience at helping you meet your goal, we're seeing that men are reporting higher rates of success than women across most categories. Enhancing intimacy, recovering from exercise are pretty much the same, whereas we see easing pain and energize and uplift, we're seeing higher ratings from men than women. And going back to, kind of this idea of what are people most willing to admit, how, cued in are to people, what their bodies and what's happening. One of the explanations I have here is that women are just kind of, the bar is higher for them to label something as a success. So, they might be thinking about their own pain or their own sleep as a more multifaceted issue than men. And so therefore they're thinking about a more multifaceted answer and solution to what they're looking for. That's really what I've come up with. David, I'm curious what you think about this difference in average success rating by gender.
Yeah, I also don't know if I know for sure what would be causing it. When this started to emerge in the data, we've been searching for studies and research about differences in the endocannabinoid system and the way that cannabinoids are absorbed by the body and by male versus female. And there does seem to be some research suggesting, and it sounds from something Sarah said earlier that she might have some good insight on this too, but it sounds like there's some differences in the ways that our bodies interact with cannabinoids basically that could be causing some of this as well. But like you said, it could also be reporting bias that women are more critical about how their bodies are feeling than men are. I'm not sure. It's one where so far I can only speculate, but it's very interesting. We've also talked about, does this mean there should be women specific cannabis products that perhaps could there be formulations that would work better for women, and that by making a one size fits all solution, we're shortchanging women but by a few percentage points across all these goals,
Well, that's really interesting. And Sarah, I want to hear your thoughts on this, but I am seeing more products pop up that are geared towards, I wouldn't say women, but more like women's health issues. So I'm seeing products around premenopause and menopause. I'm seeing issues around women and intimacy that are being represented in products. So I do think that some brands are understanding that when it comes to cannabis care, women may have some unique needs. Now, whether we start seeing tinctures or edibles that are specifically formulated for just women's needs in general, that would be pretty interesting. Sarah, what do you think about that?
Yes, yes, and yes. What I would say is that we do need more female-centric products, and we are seeing some of them. Like, for example, Cosmic View, mother-daughter team, has tinctures that are, that men can take advantage of as well with the cannabinoid count, but are using that synergy between cannabinoids and other herbs to help create a full picture. I also think that, we need to have more conversations about full spectrum cannabis. And a lot of the female centric products are female owned companies. And as we should all know, those do not get as well of funding as male led companies. And so this is really a call to be featuring and supporting and funding female founded companies that have amazing products. There are a lot of them out there that are doing great work, but they're struggling because they are not getting the support and funding as their male counterparts are.
Yeah, really good point. And yeah, Cosmic View, I tried to buy some of them yesterday and they were all out at the dispensary because I was looking for a topical. But I do think that the companies that recognize that men and women consumers may have different needs are the ones that do really well because people feel seen. And, they feel like their particular issue is being addressed by the company and they're not just trying to market to as many people as possible. So I definitely think that this data supports a differentiated approach. So let's look at side effects. This is something that was also really interesting because not only did women report lower success ratings, they reported higher levels of most side effects, except for red eyes. which men are reporting more. Everything else, and none, women are reporting side effects more often. So, again, we go back to, are women just more in tune with when they're having a side effect? Are they more willing to admit that they're having a side effect? Is there pressure on men to be like, oh, I can handle my weed and I don't have any side effects? David, what do you think is happening here?
Yeah, it could be either of those things, or again, it could be that there's something about the products that could be different, that could change these numbers or level them out or reduce them. I don't know. It's a tough one to speculate about. I'm not sure.
Yeah, what do you think, Sarah? This was so interesting to me. I didn't expect to find this, so I'm curious what you think.
And what is it about red eye? Because red eye would, maybe understanding the red eye is the key to understanding this chart somehow. I don't know.
Or maybe red eye is like the one acceptable side effect that men feel they can have and still be like an OG cannabis consumer.
Right.
Well, you can't deny red eye. It's out there for you to see. So there's that, but I also think that, and this is a gross generalization, because there are some amazing male communicators out there that really get into things and have conversations. So I'm by no stretch of the imagination saying that men don't do this too, but women tend to be communicators. We tend to want to learn more. We tend to want to compare and contrast to other people's experiences. Where
I'm not offended. I believe that's true as well on average.
Whereas, guys, especially like in the older demographics, I always joke, that, it's like the John Wayne thing. It's like, well, everything's fine. I'm getting the effects I need.
Yeah.
That other stuff, whatever. So I definitely have had male consumers who have relayed to me, their experiences and have been a little bit more reflective on them. But by and large, you get that more from women really kind of thinking, is this useful for me? Is this a good use of my time? Is this a good use of my money? Just like definitely some more reflections. Whereas a lot of the male consumers are like, I know how much THC I want. I know the effect that I want to get. I know all this stuff is going to come along with it. Therefore, it's just not important. Let's just do this.
Yeah. I mean, it could just be a different way that they approach wellness, that they approach symptom management. And this could just be a kind of a showing of that. So a couple questions that came in on the chat. One was around, do consumers have like one type of flower they usually consume, or a variety? A variety, because a Jointly app is available for you, whatever state you're in. So obviously you're going to have access to the products that are there locally available to you. So we're really talking about flower as just any strain related to cannabis flower. And then the other question was, does THC and product affect the success? And absolutely. We had that slide looking at, for different product forms, we're seeing different rates of success for different outcomes, which shows the importance of differentiating exactly what you're trying to accomplish with your consumption, and then working to find a product that is going to get you there. All right, so we have made it to the key takeaways. This was such an amazing conversation. And I want to remind folks that this report is available for free download on the New Frontier Data site. So you can go and download this report and read it in its entirety. Look at all the methodology, at all how the questions were answered and asked, and really get a better sense. We gave you just such a brief overview today of the really in-depth information that's available in this report. So just a couple key takeaways, and then I've got a closing thought question for each of you. So flower is the most popular, but not always the most effective at meeting goals. And we talked about some of the reasons this might be. People may be afraid to experiment. They may feel like they're going to waste money, and they're just going to pick the thing that they know the best, which for a lot of people is flower. But we saw that things like manufactured products like drinks and edibles may be more helpful at helping people reach certain success goals, like appetite, pain, and substituting for something else. Both cannabis and non-cannabis factors impact goal success. So when you're talking to someone about getting the most out of their cannabis experience or using cannabis for a therapeutic purpose, you want to talk about things like diet and exercise and sleep, and being in an environment where they feel safe, where they feel supported, and consuming with people that they feel safe around, where they feel support their cannabis use. All of these things, in addition to which product you choose off the shelf, are going to impact your outcomes. So if you're a brand or a retailer, really thinking about how you encourage people to consider these non-cannabis factors if you want them to enjoy your product even more, which means that they're more likely to come back to you. Consumption location was driven by factors other than goal success. So we talked about the fact that a lot of people have to consume indoors because that's the only place that is available to them, or the only place where they feel comfortable consuming is at their own home. But even if you go outside your own home and stay in your own yard, you're likely to have better outcomes for meeting your success goals, and that's even elevated when you're consuming in nature. So really thinking about how we give people opportunities to consume in various places as a way of increasing likelihood of success. Women report less success with meeting consumption goals. We talked about why this could be, everything from biology to the bar that women feel they need to meet in order to declare success, the more multifaceted ways that women may view pain and stress and anxiety that might require a more sophisticated outcome than men. So definitely a possibility. And that gender and age influence set and setting choices. So looking at which products people choose, where they choose to consume, who they choose to consume with, we do see that as being a function of both gender and age for all kinds of reasons. With age, thinking about who we're around in our lifespan, what time we have on our hands, what we do at that time. Cannabis, a lot of times, is a lifestyle behavior. So it's definitely going to be influenced by who you are, what point you're at in your life, who you have access to, and the kind of environments that you're most often in. And because of that, it's important for us to consider not just the product that people are using, but the opportunities they have for set and setting around that product when we're thinking about what's going to give them that level of success. So, I have a couple of just final questions for each of you, or one final question for each of you before we wrap up here. So David, I'll start with you. When we're talking about goals and people meeting their goals for success in consumption, dose does play a role. Now, we know that everybody's metabolism is different, everybody's level of tolerance is different, and that it changes throughout the lifespan. So do you have any thoughts based on what you've seen around how people should approach dosing?
Sure. Great summary, by the way. I guess my answer would vary whether the person is an experienced consumer or a new consumer. And the new consumer answer, I think, is always just start small. And if you don't feel the effects that you're expecting, don't add more. And wait, and then track the results. Because like going back to that idea of performing an N=1 study on yourself, if you keep track of your dose and keep track of the feeling that it provides and keep track of the time between doses, because that also obviously is going to influence your tolerance, you can find what works for you, because it's going to be different than your friend. It's going to be different than somebody else in your family. It's going to be different than the bud tender. It's really a personal journey, finding the right dose and the right time between doses and the right strength and so on. So information is power, and data helps you solve problems. And so I think, you don't have to use our app for it. Use a notebook, whatever you want, but keep track of it and learn about how it impacts how you feel. And it also really seems the impact of a dose really also seems to vary by time of day, which is a chart we didn't get into, but keep track of the dose and the time of day as well, because there seems to be a difference in how cannabis affects you based on where you are throughout the day. And then if this is my last chance to say something, I want to make a quick commercial plug. So in addition to using our data to help advance these subjects that we've been talking about, we're also building a software tool for retailers, for bud tenders. And so if you're a listener here and you're a retailer, I don't want to sell you anything, so don't worry, I'm not selling you anything yet. I don't want your money yet. But we've developed this tool with the input of a few dozen retailers, bud tenders, store managers, store owners, and I'm always looking for more retailers to talk to about it. So I'd love, if this kind of purposeful consumption stuff resonates with you, I'd love to show it to you and get your feedback. And we're kind of in the final stages of user testing and development, and I'm always looking for more voices and opinions. And I think it's a really neat tool. It seems like It's something that's both going to be good for your business because it can increase average cart size, but also help connect people with the right products through data and information about what's working best for other people like you. So
Fantastic.
that's
Well,
my plug.
No, that was a perfect plug because it leads us right into our final question for Sarah, which is, you work a lot with consumers and you know the kind of questions they're asking and what they need to know. What should brands and retailers take away from this presentation so that they can better support their customers and consumers?
I think that there's a lot of things, but I'm going to keep it short. But when we're looking at this, we really need to be looking at the long game. There are a few things that create not only abundance in revenue for your employees, for yourself, and also creating better policy. We are seeing a lot of dispensaries going into a formula retail model. Don't do it. Don't do it. Empower your staff with education. It not only creates larger baskets, it creates more successful experimentation scenarios. And it also creates greater retention because, as we know, attrition behind the bar is huge. And you really want to have a well-educated staff behind your bar. Also, having rich public education programs is really key to being able to get people to understand what works well for them, and also highlighting products that they may not have considered that will be helpful for them. And when we have empowered, educated consumers with successful interactions, that drives better policy. Because this is the time where we need to start talking to consumers about, we'd have consumers coming into dispensaries saying, prices are high and things aren't available due to the greed of dispensaries and brands. And that is not true. It has to do with policy. And policymakers have an outdated view of today's cannabis consumer. And so it is time to encourage these consumers who have had good interactions to let their policymakers know, who depend on their votes for their jobs, that they use cannabis, that they contribute to society, pay taxes, and they vote. So these are all things, when we create good scenarios, we have less people that are working against us. We create better policy. When you have support of your consumers, like I had somebody come in one time and said, I know that I can get my cannabis somewhere for less expensive, but the reason I come to you is because you educate me, you treat me with respect and compassion. And that goes a long way for relationship building. And also when you're making suggestions for products, not just to sell, but to create fulfilling consumer scenarios. And I do a lot of work with this with other companies. So just a quick plug, if you want to do training and it will affect your bottom line significantly, reach out.
Well, that's a really good segue to close out here. How can people get in touch with you, David? We had a few people asking, well, I want to know more about this retailer product. How do I get in touch?
I'm easy to find because I have a funny last name, David Kooi, Kooi. So you can find me on LinkedIn just with that. That'll be enough. Look for the bald guy with glasses. And also my email is dkooi, DKOOI @jointlybetter.com.
Excellent. And Sarah, how about if they want to get in touch with you?
If you want to get in touch with me, you can go to my website, www.sarahpayan.com. Email me at sarah@sarahpayan.com. And if you like podcasts, check out Planted with Sarah Payan. It's wherever you listen to your favorite podcasts. And next month, I am going to be doing recording with David Crosby, Peter Coyote, and also Mickey Hart. So check it out. It's going to be great. And Barbara Lee. So we'll be talking about all sorts of cool stuff.
Well, Barbara Lee is one of my favorite people in the entire world. And I want you to ask those old timer stoners what kind of side effects they get still, if any, from their cannabis consumption. Because I'd be very curious to hear if David Crosby still gets dry mouth and red eyes after his prolific career as a consumer.
You'll get my full report.
Good. Well, I really want to thank everyone for joining us. I know that this was a ton of information. Again, you can download the entire report for free from the New Frontier Data website. We'll also be making a recording of this webinar available. So if you weren't able to stay the whole time, or you've got colleagues or friends or business partners that you think could benefit, or parents or kids that could benefit from this information, please share it with them, and let's create a better educated consumer base. And I think that the retailers and the brands will follow in the way that they message. So again, thank you jointly for providing these data and for making these insights available. If you're out there and you want to have a better cannabis experience, I recommend downloading jointly and just seeing how much you learn about your own cannabis consumption just by keeping track. It's really amazing. So thank you all for joining this topic of mindful, purposeful consumption, and we look forward to the next one. Have a good afternoon.